I'm Dr. Ravel Stallings, the Corporate Medical Officer for PruittHealth. We learned a lot over the last couple of years in listening to what people would like when they come to our post-acute long-term care facilities. What we saw was a need for an option for private rooms. This not only helps with infection control and prevention, but there are a number of studies that state residents sleep better, they have less agitation, and it's less of a transition from moving from their home into our facilities. We have private rooms that also have the ability to have suites, so that if you have a best friend or loved one in which you would like to share living space with, that can be arranged.
We also didn't forget about all the lessons we learned over the last 50 years about what our residents want when they come to their home,
right.
Which is now PruittHealth.
Creating a home-like environment for them is very important. As you can tell in this particular facility, we have multiple living rooms, so there's little small neighborhoods for them to feel connected and part of a community. So this is where they live. So we make sure we spend a lot of time thinking about the furnishings and the colors and the textures and the interest and just different visual scenery throughout the facility, so everything is just not all looking the same.
We have an ice cream parlor. The ability to get coffee served throughout the day. There is always time for celebration of birthdays or special occasions so that loved ones and families can share in the experience. Our facility also offers a wonderful theater with great surround sound and always a chapel.
So this is a state-of-the-art gym. We want to be able to provide therapy techniques and devices that help the patient achieve their goals. Devices to help improve patients' endurance, for their balance. So the patient has the ability to come right over to the kitchen counter and start to work to prepare meals, to get things in and out of cupboards. Very functional tasks that the patient needs to do to be able to return home safely. As a combination of everything you see here, you'd be hard-pressed to find this in any facility, and PruittHealth has most of these devices in all of our facilities.
Thinking through the many lessons we learned during COVID, one was the need of a level 1 unit. This unit has the ability to be sealed off from the rest of the facility, and a special HVAC system, so air circulation is not intermingled with the rest of the facility. This allows us to provide excellent care for those patients that are ill while still protecting the remaining residents in our building. We also understand the importance of community and definitely don't want to isolate our residents any longer than is required. So almost every unit within our facility can access the courtyard. There's plenty of seating for our residents, families when they come to visit. All of our patients will have the opportunity to enjoy that outdoor space. So often we think of post-acute care just handling the healthcare needs of our residents. But it's just as important to make sure that their social, psychological, and emotional needs are met as well. We hope that we not only are able to take care of you or your loved one here, but we look forward to it.